Hi everyone, welcome to Raaonline. This is Dr. Ashok, consultant microbiologist. So today we are going to see about Rickettsial infection. So when we are going to see about Rickettsial infection, it is one of the most common cause of acute febrile illness in our part of the world, and it's going to be an insect-borne infection. And let us see about this particular infection. So before going into the topic, I will show you a case. With that case, we will go into the theoretical background. So here we have a 21-year-old male who have attended the general medicine outpatient department with a complaint of fever for the past 5 days, and a history of unknown insect bite in the right thigh region was present, and it's a week back the particular infection would have occurred. And on examination the pulse rate was 132 per minute, so tachycardia is there, and temperature is 102 degree Fahrenheit, so the patient is febrile. And on examination, splenomegaly is present and the black spotted lesion is present in the right thigh region. So here you are able to see the right thigh region, and there is going to be the presence of this black colored necrotic lesion which is called as eschar. So whenever we are going to see a particular case of acute febrile illness and we are going to examine the patient for the presence of this kind of any mark. So here we are going to see the presence of the eschar. So any acute febrile illness with this kind of eschar, most of the time it is going to be a case of Rickettsial infection. So before going into the Rickettsial infection, let us see about the classification of Rickettsial infection. So when we are going to classify the Rickettsiae, there are three groups. The first group is going to be the typhus group. So typhus group has two species. One is going to be the Rickettsial prowazekii and another thing is going to be the Rickettsial typhi. So Rickettsial prowazekii, it's going to cause two type of illness. One is going to be the epidemic typhus and another thing is going to be the Brill-Zinsser disease. So whenever there is going to be an acute infection followed by the reactivation of latent infection, that is going to be called as Brill-Zinsser disease. And this Brill-Zinsser disease, it's a part of Rickettsial prowazekii infection, and it's going to be similar to that of the epidemic typhus, which is transmitted by the organism called louse. So it's going to be an insect-borne infection which is transmitted by louse. And here on clinical examination, the patient can have fever, but there will not be any eschar formation. And in case it's going to be Rickettsial typhi, it's going to cause something called as endemic typhus, and it is transmitted by the organism called flea. So it's going to be an insect called flea which is going to transmit this particular infection. So and it's going to belong to the typhus group, and again there is no eschar here. So when we are going to test these patient sample against the Proteus antigen suspension, that is called as a Weil-Felix test, where we are going to use the Proteus antigen suspension, that is the OX19, OX2, and we are going to use OXK. So OXK is antigen derived from Proteus mirabilis, and OX19, OX2 is derived from Proteus vulgaris. So here what we are going to do is that we are going to allow the patient's sample to react with this particular antigen. So the antibody which is formed against this particular Rickettsial antigen, they are going to react with this particular antigen to have an precipitation type of reaction. So here this particular Rickettsial prowazekii is going to be reactive for OX19. OX2 it may or may not be reactive. And in case of Brill-Zinsser disease, there is going to be a negative reaction or a weak positive reaction in case we are going to test the patient sample for Weil-Felix test. And in case if it is going to be Rickettsial typhi, the patient sample is going to be highly reactive for OX19, and OX2 again it may or may not be positive. So in case if it is going to be a typhus group, the particular sample containing the antibody, it's going to be highly reactive against the OX19, and OX2 may or may not be. In case of Brill-Zinsser disease, the test is going to come as negative or going to be weakly positive.